Hello and welcome back to Senior Health Tips, the place where we bring you clear, practical, and science-backed advice for living a longer, stronger, and healthier life. Today, I want to talk about a topic that might surprise you. Most of us grew up hearing the phrase, "the more checkups, the better." We were told that early detection saves lives and that regular medical testing is the safest path. But here's the truth. After the age of 70, some medical checkups may actually do more harm than good. Instead of giving you peace of mind, they can lead to unnecessary worry, stressful procedures, or even dangerous side effects. That's right, not every test is automatically good for you. Medicine is not one size fits all. What helps at age 50 may not help at age 75. And if you don't know which test to avoid, you could end up spending time, money, and energy on things that don't improve your health at all. In this video, I'll walk you through the 5 health checkups you should avoid after 70. I'll explain why they can be risky, what the safer alternatives are, and how you can focus on what truly matters, living a life of quality, independence, and happiness.
Quick note before we dive in. This video is for education only. I'm not your doctor, and everyone's health is unique. Please always consult your healthcare provider before making changes to your health plan. Now let's get started. 5 health checkups you should avoid after 70.
Checkup number 1, colonoscopies. Our first checkup to reconsider is the routine colonoscopy. Colonoscopies are often seen as the gold standard for detecting colon cancer. For younger and middle-aged adults, this is very true. A colonoscopy can identify polyps or early cancers before they become serious, and that's an amazing tool. But here's what many people don't realize. After the age of 70 to 75, the risks of colonoscopy begin to outweigh the potential benefits. The procedure itself is invasive. It requires you to completely empty your bowels with strong laxatives the day before, which can be very hard on older bodies. Then, during the test, you're placed under anesthesia, which carries its own risks, especially if you already have heart or lung issues. And the colonoscope itself can sometimes cause bleeding or even perforation of the intestinal wall.
For someone in their 40s or 50s, the chance of these complications is very small. But for someone in their 70s or 80s, that risk grows significantly. In fact, studies show that the risk of a serious complication after 75 is up to 4 times higher than in younger patients. So what's the alternative? Instead of routine colonoscopies, many doctors now recommend stool-based tests, such as the FIT test or fecal occult blood test. These can be done at home, require no anesthesia, and are much safer. If something suspicious shows up, then a colonoscopy might be considered, but only if truly necessary.
The bottom line is this. At this stage of life, comfort and independence are just as important as cancer screening. You don't want to go through an invasive test that causes more harm than good. Routine colonoscopies after 70. Safer alternatives, FIT test or stool test. Animation showing colonoscopy procedure. Risk signs, bleeding, anesthesia. Senior using a home test kit with a checkmark.
Checkup number 2, PSA test for prostate cancer. The second checkup to avoid is the PSA test for prostate cancer. This is a simple blood test that measures the level of prostate-specific antigen in your body. It sounds harmless, right? Just a blood draw? So why would it be a problem? Here's why. PSA levels can rise for many reasons other than cancer. Things like an enlarged prostate, an infection, or even recent sexual activity can increase your PSA. That means a high PSA result doesn't necessarily mean cancer, but it does lead doctors to order more tests. And this is where the real harm comes in. A high PSA often leads to a biopsy of the prostate. This procedure is not only uncomfortable, but it also carries risks of infection, bleeding, and hospitalization. Even worse, sometimes these biopsies detect very small, slow-growing cancers that would never have caused problems during your lifetime. Yet, once the word cancer is on the table, many men feel pressured to undergo surgery or radiation treatments that can lead to serious side effects, including urinary incontinence and loss of sexual function.
So instead of helping you live longer, the PSA test may actually lower your quality of life. That's why most medical experts say routine PSA screening after 70 is unnecessary. But if you feel fine, routine PSA testing may do more harm than good.
PSA test after 70. Focus on symptoms, not numbers. Blood vial labeled PSA. Red X across unnecessary biopsy. Doctor calmly explaining results to an older man. Checkup number 3. Mammograms. Now let's talk about women's health. Mammograms are an important tool for detecting breast cancer in younger women. For women in their 40s, 50s, and even 60s, they can save lives. But after the age of 70, the situation changes.
Breast cancers in older women often grow more slowly. In fact, some of them may never cause any harm during your lifetime. Yet mammograms can still detect these tiny cancers. The problem is, once they're detected, you may end up undergoing surgery, radiation, or even chemotherapy, all of which carry serious risks for older adults. These treatments can weaken your body, affect your immune system, and lower your independence, even if the cancer itself might never have been life-threatening.
Another problem with mammograms is the false positive. This happens when the test shows something suspicious, but it turns out to be harmless. For younger women, this is stressful. But for older women, it can mean multiple additional tests, biopsies, and weeks or months of anxiety. So, what should you do instead? If you're over 70 and healthy, talk with your doctor about your personal risk factors. If you have a strong family history of breast cancer or concerning symptoms like a new lump or nipple changes, then testing may still make sense. But if you don't have risk factors or symptoms, routine yearly mammograms may not be worth the stress and risk.
Mammograms after 70 routine. Focus on risk factors plus symptoms. Breast X-ray turning into a warning sign. Woman talking to her doctor calmly. Text overlay. Discuss risks, don't guess. Checkup number 4. Full body scans. The fourth checkup to avoid is the full body scan. You've probably seen advertisements for these scans. They're marketed as a way to catch hidden cancers early or give you peace of mind. Sounds great in theory, but in reality, full body scans often do the exact opposite.
Here's the problem. These scans frequently detect what doctors call incidental findings. These are tiny spots, nodules, or shadows on your organs that look unusual but are completely harmless. In fact, most people have them and they never cause illness. But once a scan picks them up, doctors feel obligated to investigate further. That means more tests, more scans, more biopsies, and sometimes even unnecessary surgeries. All of this creates a cycle of anxiety, cost, and risk. And let's not forget, CT scans expose you to radiation, which itself can be harmful if repeated too often.
The safer approach. Only get scans when there's a clear reason, such as a symptom, a doctor's suspicion, or a specific medical condition. Scanning your whole body just in case is usually not helpful, and it may cause more problems than it solves. Full body scans equals false alarms plus radiation. Use scans only for real symptoms. Animation of CT scan machine scanning a body. Dollar bills flying away. Doctor pointing at harmless spots on a scan. Arrow, overlay,
incidental.
Checkup number 5. Bone density tests. Finally, let's talk about bone density tests. Osteoporosis, or weak bones, is a real concern as we get older. Broken bones can take away independence, mobility, and even shorten life expectancy. That's why bone density tests are helpful, but only when used properly. The mistake many seniors make is getting these tests too often. Some people do them every year, thinking that more testing equals better protection. But here's the truth. Bone density changes very slowly. Doing the test every year doesn't add much value. Instead, it can cause unnecessary anxiety when you see small changes that don't actually matter. It can also lead to over-treatment with strong medications that carry side effects like jaw problems, stomach issues, or kidney trouble.
A better approach is to get a bone density scan every 2 to 5 years, unless you have new risk factors such as a fracture, long-term steroid use, or a sudden change in health. And remember, lifestyle matters even more than testing. Regular walking, strength exercises, eating calcium-rich foods, and getting vitamin D are the best protectors of strong bones. Yearly bone scans. Every 2 to 5 years plus lifestyle changes. Skeleton animation showing bone strength. Seniors, walking, lifting light weights, or gardening. Overlay, walk, calcium, vitamin D.
Conclusion. So let's recap the 5 checkups to avoid after 70. Colonoscopies, routine. PSA tests for prostate cancer. Mammograms, routine. Full body scans. Bone density tests done too often. The key message is this. After 70, health isn't just about chasing every possible disease. It's about protecting your independence, your comfort, and your happiness. Too many tests can actually take those things away. Instead of worrying about every checkup, focus on the habits that truly matter. Staying active, eating well, sleeping enough, and keeping a positive mind.
Your experience and opinion in the comment below, we'd love to hear them. Thanks for watching.